everyone, and welcome to today's talk. My name is Rachel and I'm a speaker for Your Personalised Vitamins. I'm going to be talking about today vitamin D deficiency as a predictor to mortality. The reason that I've put this presentation together is due to the ever increasing interest in vitamin D and the health benefits of vitamin D, even more so now through the COVID-19 pandemic. So my presentation today is going to be split into two sections. To begin with, we'll be talking through or reviewing a study reported on by Becky McCall in the Medscape Medical News, published in September 2020, so very relevant to today. Study is called Low 325 or 250HD, vitamin D is the best predictor for mortality. And the second part of my talk today will be looking more into Your Personalised Vitamins, who we are as a company and what we can provide and how we can help you. So just before we get started, I wanted to make sure that everybody has an understanding of the two metabolites of vitamin D that I'll be discussing throughout this presentation. So to begin with, the initial metabolite that food and sunlight provide us with is 2,5-hydroxyvitamin D. And you'll see this written in shorthand throughout as 2,5-0HD. And the status of this metabolite is free. So the initial metabolite is free. The secondary metabolite, so our body metabolises this initial vitamin D metabolite and activates it within the kidneys to give us 1.25 dihydroxyvitamin D. You'll see this written in shorthand again as 1.250H2D throughout this presentation. And the status of this secondary metabolite is active. So just to recap that, just to summarise, the initial metabolite, food and sunlight provide, it's a free metabolite and shorthand 250HD. And then our body further activates this initial metabolite in the kidneys to give us 1.25 dihydroxyvitamin D. And the status of this metabolite is active. So we're all aware that vitamin D levels are routinely assessed in the clinical environment. And when doing so, the clinician will check for both of these metabolites. So firstly, they'll check for the 250HD metabolites, that initial metabolite, and then secondly, for the secondary metabolite, the 1.250H2D metabolite. And together, this will indicate whether or not an individual is vitamin D deficient. And so they'll use the sum of both metabolites to indicate whether or not an individual is vitamin D deficient. So what's the purpose of this investigation and what are the key points of this article? So this study that I'm reviewing today investigates if the standalone free, so the initial metabolite 250HD, is a stronger predictor to age-related disease mortality, usually when investigating into vitamin D and the metabolites, and if they're a predictor to age-related mortality, the two metabolites combined are used. So this study is looking into if the combined metabolites or the standalone metabolites are a stronger predictor. The article then goes on to cover some of the medical conditions as a result of vitamin D deficiencies. This includes cardiovascular disease, cancer, osteoporosis, which we all know or we all associate with the elderly or an ageing population. Unfortunately, it is widely recorded and widely researched into that these individuals are often the patient group that are more susceptible to vitamin D deficiencies from the offset. So the actual article itself, really good study size, 1,970 men participated, and the study period was 2003 to 2005 with a 12-year follow-up. So again, really good lengthy follow-up there. And the age ranges included were 40 to 79, so really good representative pool of the ageing man. So all good there. And each individual received two measurements. So firstly, they were checked for their total metabolites, so the two metabolites combined, given a value. And then secondly, the free metabolites, that initial metabolite. And then they were given a value. So each value was then given a HR ratio and measured against the men's current health status. So what we mean by that were adjustments were made for co-founding factors, including age, BMI, smoking status, and health, self-reported health. So each value was then given a hazard ratio depending on those adjustments. So now moving on to the study findings, the data was split into quintiles. So a quintile is an equal fifth of the data. So the data was split into 5 equal segments. And what we can see here, and what was reported, that the 250HD metabolite, those individuals that reported the lowest levels, of the 250HD, had a 91% increased risk of all-cause mortality over those that were present within the 5th quintile. So the results showed that they had the highest levels of the vitamin D metabolite. So really, really big difference in results there. The researchers were then able to conclude that looking at the standalone free, so the initial metabolite, the 250HD free metabolite, is a much stronger predictor for mortality than the 2 metabolites combined. So by no means are the researchers suggesting that the 2 metabolites combined isn't a strong indicator of mortality or age-related mortality. It's just that the standalone metabolite is a much stronger predictor. We are aware, however, and so are the researchers, that there'll need to be additional investigations into this subject. Also the need for research into additional comorbidities such as obesity and sun exposure for the participants. So I'd just like to summarise again, just before we move on, how we access this 250HD metabolite, and that is through sunlight, food and supplements. So we access the free metabolite through sunlight, food and supplements. So now moving on to the secondary part of my presentation today, which gives you a bit of background information into your personalised vitamins. Who are we? What can we do for you? So we are a healthcare company with a wealth of experience in supplying the public with medical devices. And what we've actually gone on to create is the world's first vitamin D home testing kit. So why would you want to apply for a home testing kit? Why would you want to sign on to our vitamin D supplementation programme? As a result of sending you 2 annual vitamin D home testing kits, we will be able to personalise and adjust your supplements to ensure that you're kept at optimum levels throughout the year, regardless of the seasons. Not only is our home testing kit cost effective, you'll also receive your results in 20 minutes to the app on your phone. You'll also have access to coaching and training to ensure that you get the best out of our service. So I just wanted to highlight before moving on what we're actually looking for and what we're testing for within our home testing kits, and it is actually that 250H vitamin D metabolite that I've been discussing throughout this presentation. So you'll be able to get a result in 20 minutes in terms of your 250H vitamin D modulite levels. So what have we found? What are our initial findings? Your personalised vitamins, what have we had feedback? What is the feedback that we've had, Customers are on supplements but are still deficient. So individuals who are taking vitamin D supplements are still not reaching their optimum levels. The number of customers are taking excessive levels of supplements. So they're taking a too high a dose. There's not that understanding of what the optimum level is. And then customers or patients have also been to their GPs and had these vitamin D levels tested within the primary care setting. They've been given an initial loading dose, but afterwards there's no support continuing forward. So they've been left to buy their own supplements. And then again, you run the risk of, going over or not quite reaching your optimal level. So just wanted to summarise really by saying, people are supplementing in the dark. There's not that education out there on how to ensure that you reach your optimum level throughout the year. So that's all from me today. Thank you for listening in. I've just put the 2 links at the bottom of this presentation here, at the bottom of this slide. So you've got the study link which you can access, and then our direct link to get to your personalised vitamins. Please subscribe to our YouTube channel for more videos to come. Thank you. Bye bye.